Calcium Metabolism, Part 2, looking at hypercalcemia.
So
Dr. Muhammad Abdi, say hello.
High levels of calcium. So we want to find out the causes of high levels of calcium.
Yep.
The most common cause is malignancy.
Okay.
Yeah?
Yep.
Malignancy.
Brilliant.
The second most common cause is primary hyperparathyroidism.
Okay.
Third cause is high thyroid levels. Fourth cause is excessive vitamin D and other causes. Yeah? So let's start.
Don't forget milk alkali syndrome.
Yeah, milk alkali syndrome, which you'll remember. Malignancy is the most common cause of hypercalcemia. People who come with high calcium levels tend to be hypercalcemia. Yeah? First, what do we define as hypercalcemia? What is the normal calcium levels? You need to know that.
We do.
Because, exactly. It's levels above, levels between calcium levels. It's 2.25 to 2. I presume is 50
Is that plasma?
in plasma.
So is this total or adjusted?
This is calcium adjusted. Less than that is hypercalcemia. Higher than that is hypocalcemia.
Right.
Yeah?
So what are the units for this?
Millimoles per liter, always. Yeah?
Okay, brilliant.
Above that is hypercalcemia. So what are the causes of hypercalcemia? Malignancy.
Yep.
Malignancy we can differentiate into plasma, hypercalcemia due to plasma,
So humoral?
humoral hypercalcemia, metastatic hypercalcemia, so cancer spreading out from other sites,
Okay.
and thirdly, hematological, blood occurring hypercalcemia. Humoral cause is the most important.
Yes.
These are due to tumors, solid tumors, secreting hormones like PTHRP.
So that's parathyroid hormone relating peptide.
These are commonly secreted by tumors such as lung tumor
Yep.
and renal cancer.
Okay.
This tumor secretes parathyroid relating peptide which acts like PTH.
Yep.
Yeah? It's well known that lung cancers, especially squamous cell carcinoma, produces PTHRP.
Okay.
Yeah?
Cool.
Second cause is this PTHRP is also known as paraneoplastic syndrome.
Okay.
Do you need to know the meaning?
Paraneoplastic syndrome means that it is an indirect cause of hypercalcemia due to secretion of hormones which therefore cause increase of calcium secretion.
Yeah. So these are cancers. Paraneoplastic syndrome means cancers, the indirect symptoms of that cancer is by secretion of hormones,
Okay, brilliant.
not direct.
Okay, brilliant.
Second cause is metastatic. Breast cancer tends always to spread to bones.
Okay.
So when they spread to bones, what do? They increase osteoclastic activity in bones, causing break of bones. So patients with breast cancer you'd find that they've metastasized. Breast cancer tends to metastasize to bones. So what happens? Patients with this can cause hypercalcemia. It's not known why they spread to bones, but it's due to thought by the process of soil to seed hypothesis.
Let's forget about that. Okay, brilliant.
The third cause is hematological hypercalcemia, such as hypercalcemia.
No, such as multiple
myeloma. Yeah. The second most commonest is primary hyperparathyroidism. This is due to parathyroid tumors, which are benign. They tend to secrete excess secretion of PTH abnormally. Yeah.
Okay.
There's no imbalances because they're tumors. What happens? They'll cause PTH, will cause the effects, yeah,
Yep.
of calcium reabsorption, phosphate excretion, so causing hypercalcemia, hypophosphatemia. hypercalcemia,
Hypophosphatemia due to kidney reabsorption of calcium and kidney excretion of phosphate.
Thirdly, thyrotoxicosis, production of excess thyroid hormones, which can also cause calcium resorption.
Okay, brilliant.
Yeah. D, excess vitamin D. Think about it. What controls calcium?
Vitamin
PTH,
D. Vitamin D.
So, vitamin D excess would cause hypercalcemia. How do we get excess vitamin D? High intake of vitamin D.
Such as, what foods are high in vitamin D?
Such as excess in sunlight, yeah, and causing too much hydroxylation by the kidney.
Okay.
Yeah?
Where is vitamin D made?
Vitamin D is normally got from hydroxylation, basically formation of OHD3 in the liver, then they tend to be hydroxylated in the kidney.
Okay, cool.
To be made into active vitamin D.
Okay.
Yeah. Other causes are things like sarcoidosis, which is a lung problem, and this lung problem tends to cause hypercalcemia. And then lastly is milk alkaline syndrome.
So milk alkali syndrome is just, for example, children that consume too much milk. Obviously, milk has calcium in it, therefore that causes hypercalcemia. Okay, brilliant. Let's go on to the symptoms.
So what are the symptoms of these patients normally with hypercalcemia?
So
it's normally that you diagnose patients through symptoms.
Okay.
Yeah?
Brilliant.
They present with their symptoms. They don't present with their blood levels.
Yeah.
Yeah? Symptoms of hypercalcemia are, we can remember it, bone, stone, abdominal groans, and psychic moans. From there we can derive all our symptoms. Bone, bone pain. Stone, stone formation, commonly in the kidney, causing kidney stones. So patients will present with tummy pain, feeling sick.
Flank pains.
Yeah, flank pain. Abdominal groans, abdominal pain, nausea, vomiting, loss of appetite. Psychic moan, high levels of calcium, continuously will cause confusion in patient. Lastly, with polyuria and polydipsia.
Brilliant.
Yeah?
Okay.
The investigation. How do you investigate hypercalcemia? First, you want to find out whether the symptoms are related to hypercalcemia. So first, measure the calcium level to find out if it's hypercalcemia. Once you find that hypercalcemia is due to the cause, is due to hypercalcemia, then you want to find out about the phosphate levels. This will give us a good indicator if phosphate level is related to PTH or vitamin D.
Okay, brilliant.
If the calcium is high and phosphate is low, that tells us it's relating to PTH.
Because PTH causes excretion of calcium and reabsorption of phosphate in the kidney.
Yes, so we need to do PTH, I'll say.
Brilliant.
Other causes, do you remember we said lung cancer? Yeah. So we can do a chest x-ray. Yeah?
Okay.
We can also do CT. Yeah? Which we can do CT of the chest, abdomen, and pelvis. Why are we doing the CT chest, abdomen, pelvis? And sometimes people do neck, chest, abdomen, pelvis. Neck, chest, abdomen, pelvis. Why? You're looking for malignancy. Yeah?
Yep.
Lastly, urine electrophoresis you might do to check for myeloma, especially Benz-Jones proteins.
Benz-Jones proteins are derived of light chains of the monoclonal antibodies secreted by multiple myeloma, so
which are found in the urine, and you
can
do that by doing urine electrophoresis.
Okay.
So how do we treat hypercalcemia? Simple. They're having polyuria, polydipsia. They're very dehydrated. What happened? The calcium levels in the blood. So what you need to do is you need to dilute the calcium, or else you form the stones. You become more confused. So give fluids.
Yep.
IV fluids. Okay. You can't take enough fluids more orally. You need to give them IV fluids. Secondly, you might need to consider bisphosphonate. This increases osteoblasts and decrease osteoclast formation.
Osteoclast formation. What do the osteoblasts do?
Osteoblasts, they cause bone remodeling. Osteoclasts cause breakdown of bone. So you want to prevent
cluster bomb.